When the phrase drug addiction is mentioned, most people's first thought goes to street drugs such as marijuana, cocaine, and ecstasy. Not many people realize that across the board there is a large abuse of prescription drugs, as some prescription drugs can be addictive in their nature. Sandra Lawton, who's the author of Drug Information for Teens, defines drug addiction as the compulsive seeking and use of drugs. Prescription drug use doesn't differ that much from recreational drug use in the fact that both drugs can be very addictive and can have very serious side effects. Young people are increasingly abusing prescription drugs, which can be due to the increase in online pharmacies, which often don't require prescriptions from doctors, as well as farming parties. Now, farming parties have become popular, but not because young adults are going out to the farm and hanging out with animals. Rather, they're taking prescription drugs, farming, and from their family's medicine cabinet and bringing them to a gathering, and everyone brings some and then they share. Many people take pills based on the color and the size, not based on the name, so they don't even know what pills they're taking together, which can cause very serious side effects. In USA Today, Donna LeWand wrote about a study that was conducted in 2005 by the University of Michigan, which found that among high school seniors, use of Vicodin and oxycodone was much more widely used and preferred over ecstasy and cocaine, which is surprising to some people. One of the most commonly abused groups of prescription medications are opioids. Opioids act as block pain receptors, so the brain doesn't perceive that there's any pain in the body. Now, there are opioid receptors when the brain, the spinal cord, and the GI tract. And Michelle Van Kranken, who wrote on the Teens Health website, informed that these opioid drugs block the receptors from transmitting signals to the brain that they are experiencing pain. Therefore, the body doesn't feel any pain, and a type of high comes throughout the body. It's very important to realize that opioids, which contain things like Percocet and Vicodin and other pain medications, cannot be mixed with alcohol in any instance. Doesn't matter how well you can tolerate alcohol or the pills, they are not ever a good combination. Another group of prescription drugs that is being commonly abused by young adults, especially college students, are stimulants. Stimulants are often used to treat attention deficit disorder and attention deficit hyperactivity disorder, ADD and ADHD respectively. Now, these drugs help you stay awake and help you stay focused, which is beneficial for people who do honestly suffer from ADD and ADHD. It helps them focus and get their day's tasks completed in a timely manner. Now, people who don't experience ADD or ADHD and who still take these drugs, respectively Adderall and Ritalin are two most commonly used, do still experience the same sensation of that the drug keeps you awake and that it keeps you very focused. But taking too much can have very serious side effects, which include irregular heartbeat, high body temperature, an increased chance of seizures, and even cardiovascular failure. College students often feel a very intense pressure to score a very high GPA, to maintain a 4.0, to maintain a 3.5 GPA, in order to be competitive for graduate school courses, or to enter medical school or pharmacy school. Because in this day and age, just having a bachelor's degree is often not enough to get your dream job. In addition to trying to study for their classes to get good GPA, to maintain a good GPA, You also want to be a well-rounded student in that you have your own downtime, you have a social life, you're involved in extracurricular activities, um, sports, and often students have to work to pay for tuition and books, as not everyone can afford to go to school and not work. Sandra Lawton also indicated in her paper, Drug Information for Teens, that drugs for ADD and ADHD cause blood vessel constriction and an increase in blood glucose level, which can be harmful when you are taking medication that's not prescribed for you because your doctor doesn't know you're taking these medications, and if you already have outstanding medical conditions, it can worsen it. Another category of drug that is often abused by young adults isn't even prescription, it's over the counter. In that, pseudoephedrine is a product that is often contained in cough medicines and products like Claritin D or Sudafed D, which are now behind the counter in the pharmacy. Young adults have learned how to make methamphetamines out of the pseudoephedrine in these products, and now there are limits on them. Sarah Baldouf wrote in U.S. News in 2005 that the limits on these medications are 3.5 grams a day or 9 grams over 30 days. Many prescription drugs are taken exactly as prescribed by the doctor, yet there is an increasing rate of misuse and abuse of prescription drugs across the board, regardless of gender, age, education, or background. College students often begin to take drugs to fit in at a party or to keep them alert without fully realizing or considering the high that they feel is going to wear off and that it is often not worth the medical consequences. The amazing high you may feel from mixing opioids and other medications from taking prescription drugs improperly may wear off in a few hours, but the consequence you can't take back. You have to think twice. You only die once.